Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello everybody, today on the weekend I am here bringing you a new expert about pelvic floor, and we are in the city of Toronto. So this podcast is dedicated to all the women out there that are either getting ready to have a baby or are actually mothers. So today we are with Nav. I met Nav in Toronto Yoga Mamas, and she is a pelvic floor physiotherapist. And she's going to be sharing with us some information about the pelvic floor and about the core. So some muscles that are being neglected, and after pregnancies, we realize how important they are. So Nab, tell me, how are you there and how was your week?
Oh, it was really good. Yeah, thank you so much, first of all, for having me on. I'm very excited to talk about everything regarding to pelvic health. I was actually working today at Toronto Yoga Mamas, so we get a lot of women coming in on the weekends for prenatal as well as postpartum care. Yeah, so I've had a good week trying to educate a lot of people about pelvic floor. That's what I do all day long.
Nice. That sounds really interesting and it's so needed. As a personal trainer, I have seen this happening a lot. After having kids, the mothers suffer of the weak muscles on the core, and that's when they realize how important it is to have a strong core, and they start exercising. They notice the difference. And today, I just wanted to give a little bit of information about who you are and what you do in the city of Toronto. So you are a pelvic physiotherapist that serves in the city of Toronto, and after graduating physiotherapy school, Nav has drawn as a woman health and decided to focus in practice in the area. So you work with the pre and postnatal patients, teaching about pelvic floor dysfunction, and you also work in collaboration with obstetrician and urologists, as well as gynaecologists. And you also have this intention to empower the woman to strengthen their whole bodies, and you become a model for many women in your time off. You love to do yoga and you love to do spin and find some areas for hiking and adventures.
Yeah, I love that. I think that in terms of empowerment, a lot of women are told postpartum, okay, you have your baby, okay, like you're good to go kind of thing. And the focus a lot of the time is on the baby, less so on the actual mother. And to the extent where moms are not taking care of themselves and their health, and that kind of gets pushed to the side. And then, so when they do come to me, it's with issues, right? And you kind of see the other side of it, because they will ask me, they're like, oh, I'm having all these issues in my pelvic area. I want to start training, or I have been training. And so it's interesting because, I am collaborating with fitness specialists, but I never see them.
Yeah.
It's kind of like getting the patient to a certain place, and then you're getting them to a certain place, and we're kind of like meeting in the middle. But for sure, there's a lack of focus on women's health, I feel like, in Canada and North America. A lot of my patients in Europe, or who have like a background, European background, they are told by their friends to go see a pelvic floor physiotherapist during pregnancy as well as postpartum. And it's also funded by the government in France, Germany, Spain, other countries, whereas here it's not so much.
Yes, Nav. So today we want to dive deep in the main muscles that attach to our bodies. I teach Pilates and I teach yoga. So I have to learn a lot about these muscles. I actually have scoliosis, so I used to suffer of very poor core muscles that it wasn't sustaining my back. So I definitely needed to get into the real business of the spine, which is your core muscles. And that's how I improve my posture. So for the core muscles, I would love everybody to see, the ones that are actually able to watch the YouTube video. Can you please show us the bone, the pelvic bone model that you have with you? Thank you for bringing it. And we can take a look at how the bone looks, and you can just explain to us which muscles are attached to the hip bone and which muscles are the ones that are stabilizing the pelvic floor. Thank you.
Yeah, okay, so I'm going to show a model. So this is the pelvic area. So if you notice up here, this is actually the spine. Okay, and I'll show it from the back. Okay, so this is the spine. It goes all the way down, ends in the tailbone, okay, that we're sitting on right now, most of us. And then in the front is the pubic bone. Okay, so that's the bone kind of like lower abdominal area. And then these guys on either side, it's called the iliac crest, but it's basically the love handles, the hip bone. If you kind of like go onto your waist and push down, you'll feel a bony area there. Okay.
Correct.
And the hip muscles, the hip bones, the legs, they would be coming down this way. Okay. So that's just orientation. The pelvic muscles, so they run from the pubic bone, and you can see them in red here. Okay.
Correct.
And they're going all the way back to the tailbone. Okay. So they actually attach to the spine. If you think about it. Yeah. And these muscles are deeper in the body, so you can't see them. Okay, so if you think about the glute muscle, the bum muscle that we're sitting on, these muscles are deeper to that, and they work as a part of the core. So there's a lot of misconception of what the core actually is. I'll get a lot of women coming into me, and they usually say postpartum, my abs and my core feels really weak.
Yes.
And by core, they usually mean abdominal muscles, okay, that are like kind of like over here at the top here. But the core is so much more than that. So the abdominal muscles work with your pelvic muscles, back muscles, as well as hip muscles, right? And so if they're only focusing up here, we're losing kind of like 3 out of the 4 things. And so my focus is to get them to kind of start thinking about, okay, like what is going on inside that could be impacting the way you're moving, your strength, if you're having any symptoms like leakages with exercise. And these muscles have to support organs. They don't just sit there. So I'm going to show a couple organs here. So this is the bladder. This would go in here, right? The rectum, that would also go in here. And then for women, uterus. So if you think about the amount of weight that's on there already, and then on top of that, if there's a baby, right, that's more weight and pressure on the muscles. And then after delivering the baby, that's a lot of strain on the muscles. So these muscles get strained, they never stop working, and afterwards they have to kind of like hold everything in. And that's where usually women have issues with bowel, bladder, pain with intercourse, feeling weak generally in that area.
Great. Thank you so much, Nav. I definitely feel like a lot of people looking at the bone structure that we all have, now we have much easier way to understand that our pelvic floor is like a bucket that supports and it holds, it contains so much of our sacred, vital parts of our life, so we do have to take care of this sacred area, and that's why we're here educating women in this area. I'm also a Thai massage therapist. We also start with the energy chakras. So we have the root chakra, and we also, it runs energy from that grounding area all the way up. So it's very important to know that the pelvic floor, it supports us in many ways, deeply, spiritually too, right? So I also believe that once this area is very strong, then our home, right? Like our home is established with this area. So going now back into physiotherapy with the bucket. So the bucket could be tilted to the front or to the back. So like a pelvic tilt could be anterior or posterior, right? So we have those people that are like sticking the butt out, like anterior, or the ones that are actually hunch over with the pelvic back, like posterior. So this creates muscles, right? They are going to be stretched, and the other muscles are going to be too long. So they're going to be short and long muscles that will create imbalances. So talking now more about what are the primary muscles of the core. So we talk about the front abdominals and the back hamstrings. We also talk about the hip flexors and the erectors, including the glutes. So it's so complex. Tell us a little bit more of these muscles. Which ones are the ones that we neglect normally?
A lot of what I see in the clinic. So if someone, especially if they're coming in with pain, and this could be pain during pregnancy, as the woman is growing, everything is getting stretched out and the muscles have to work harder, or it could be postpartum because they're having to do a lot more lifting with the baby around the home. I tend to find a lot of people tend to, like, I don't know if they're neglecting it or in general the body, the muscles are lazy or overcompensating by using other muscles, but the glutes are a big one. Like the hip muscles and glutes I find get so neglected, very, very weak. I grew up partially in India and everyone squats to the ground. Here I find people are walking, sitting with their hips like bent like this or lying down. No one is really squatting to the ground and fully using their glute muscles. And then when it comes to postpartum, having to take care of their child and they're kneeling down, then they're having these weird aches and pains. So the glutes are a huge one that I find. And if the glutes are weak, people are getting more knee pain.
This is so true. This is so true what you're saying, and this is affecting not just mothers, it's affecting almost everybody in the population of this nowadays that we always sitting, like you're saying. We definitely need to get out of our chairs and move constantly to get these muscles active and activate, fire the glutes, which are the biggest muscle of the body, the glutes. So it's not about having a nice booty, but also to have a strong booty because it connects the upper and the lower body. So actually today, which seems like the first topic was just about talking about the core, which is like a very wide topic, but I just wanted to like start from the middle, which is the most important. It's the meaty part of our topics, which is going to be the core muscles. I think this one is one of the most important part because when everybody understands that core, it goes beyond abdominals. Everybody thinks I'm going to do a core class. It's like abs class. No, abs class are connected to the core. So basically we're working on the lower back, glutes, hamstrings, inner thighs. We're talking adductors, abductors, so many. So now, just to go into one question that I have for you, I know you're going to educate us in this, the Kegels. Let's talk about the Kegels. This is something really interesting. It's being out there with the yoga and the Pilates. We do a lot of Kegels, we do a lot of breathing, but isn't it right that a lot of people are just doing it wrong? Tell us a little bit about Kegels. Like, what is a Kegel, and what are the best ways to perform Kegels?
Okay, so Kegels, you know what, and like, I think this is just a term that a lot of people will throw around, but so Kegels were created by Dr. Kegel. There was actually a physician, that was his last name, and as a way to help strengthen the pelvic floor of women. So Kegel is basically a pelvic floor contraction, so I'm going to show those muscles again. So when these muscles are contracting, they're kind of like closing and pulling and holding everything in, okay? So if you think about a bicep curl being that contraction, so a Kegel is a pelvic floor muscle contraction, and just like with any muscle contraction, you can do a little bit, you can do a lot, right? You can kind of go in between, but the goal is to help strengthen the pelvic floor muscles so that if someone has symptoms like leakages or prolapse, that it's, helping it improve, or we're trying to prevent those things from happening postpartum if we teach a woman that during pregnancy. So that's what a Kegel is. Sorry, the second part of your question kind of cut out.
Okay, so now that we know Kegels, so Kegels are just an exercise that is stimulating the pelvic floor. And it's just like tensing, right? We're tensing the muscles that are across our pelvic floor, but we're not just tensing, but also holding, right? So tell us how to perform properly the Kegels.
So the way the muscles contract, so yes, first they close, then they lift, okay? A lot of people will just be doing the closing, letting go, closing, letting go. That's what I usually see in my practice as well. And actually research shows that about 50% of women are not doing Kegels properly. I would say 80 to 90% of my patients are not, for a couple different reasons. One is we can't see the muscles, right? So it's hard to know what a muscle is doing if you can't see it, if you can't feel it properly, right?
Yeah.
And it also matters like the position they are in as well.
Yeah.
So
like we
the
actually
best
can do
way
it now.
to
Can
do
you
it-
teach us how to do it now that we're sitting? I actually can feel if I actually concentrate. What should I do? If you were
Yeah,
like, if I never have done Kegels and you instructing me, how would you instruct me?
So there are a few cues that I use with my patients to help them activate the muscles that they can't see. One of them is pretend that you are trying to stop the flow of urine or pee, okay? And everyone is a little bit different, okay? So you should feel inside tightening around the vaginal area as well as lifting. Another cue I like to use is if there's a little marble at the vaginal entrance, pretend that you're trying to kind of like squeeze and pull it inwards into your body. So it's not just tightening, it's like you're trying to lift it in. And other therapists will use elevators. So you can pretend that you're at the ground floor and the elevator inside your vagina is slowly going up to whatever floor you want it to go up to.
Yeah, that's a great way. That's a good analogy. So we close the door of the elevator, and then we lift the elevator as high as possible. And as like any other muscle, the more you practice, the stronger it gets. So there is actually apps out there that we can practice these Kegels, the Kegels app, like everything with technology. And by the way, guys, if any father or a man is listening to this podcast, actually Kegels are also very, very great for men. This is not just for women. This is actually for any human because guys also, by practicing this, they will also enhance the erections, and then also the penis is going to get stronger. So this is not just for women, this is also for men. So the Kegels is definitely a technique, and I think as a Pilates and yoga teacher, one of the main cues that I use is the breathing, because if you hold the breath or you're not using the breath properly, you're going to be forcing, and instead of like going with the flow that is natural, it gets harder. So could you help us with the breathing? How do we do the breathing?
The breathing is very important. You never want to hold your breath. As soon as you start holding your breath, the muscles, that's a lot of pressure inside on the muscles, and they won't be able to do that lifting that we want them to do, okay? So generally, I like to teach doing the Kegel on the exhale, but the exhale, the way you do the exhale is very important. It cannot be a forceful exhale. You would want it to be a nice, gentle exhale. If you breathe out like you're trying to blow out a candle, the abdominals are going to grip and engage and get very, very hard. And then the pelvic muscles inside, they won't be contracting like we want them to. So the exhale has to be very gentle. And as you're exhaling, then you're thinking about either the elevator or lifting in that marble at the same time, or doing the stopping pee, like that visualization in the mind.
Yes, I think that's great tools that we just kind of share with people, and I'm sure people where now they're sitting, they could try, they could feel, oh, I didn't realize I have those muscles. And the best way to start is every time you go and pee, just hold your pee, hold the pee and release the pee, and maybe you can hold 5 times every time you pee. That's a good way to stimulate those pelvic muscles.
I would actually, so a lot of physicians will also say this to their patients, to try to hold their pee as the urine is coming out just once. Don't do it repeatedly, because that can actually lead to urinary retention as well as infections.
Okay.
Because those muscles are supposed to relax as you're peeing. If you try to tighten them, they get very, very confused, and they're like, oh, okay, I thought we're supposed to relax now, but now she's tightening. So just to do it once is good, to be like, okay, I'm actually able to do this. And then after that, don't do it on the toilet. Do it like sitting on the subway, walking, lying down, that kind of thing.
I used to do it in every stop light.
Yeah, every stoplight. There you go. That's how you get your Kegels in during the day.
Yeah, that's a good idea for those that drive. And so, wow, that was like almost 20 minutes chatting of core muscles and Kegels. So I think it's great education. Just the first chat that we had, I think I had a lot of information that I actually didn't know. Thank you so much for sharing and to demonstrate everything with the pelvic bone. It was super educational. I think everybody just got a lot of the information today. So I'm so grateful to have you here today. Thank you so much for sharing your time with us.
Thank you again for having me. And yeah, it's awesome. It's always good to have a visual, and now everyone can go and do their Kegels until the next time we chat.
Yeah, so, well, our challenge will be to practice Kegels, maybe focus on in a certain time of the day. So it could be maybe close to lunchtime, or like maybe when you are driving to work, or sometime just focusing, just put the energy into activate those muscles. And for the woman that are pregnant, they can do Kegels when they're pregnant, right?
Correct. And I actually recommend and strongly advocate for women doing Kegels during pregnancy as a way to prevent anything from happening postpartum.
Okay. And one more question. So a woman that had a baby after postpartum, how quick the woman can perform Kegel exercises?
Day 1, day 2, as soon as possible. And then some women will be like, okay, well, what if I have stitches, right? If there's any tearing. I usually say start as soon as possible. Okay, it's just like if you got a knee surgery, they would tell you, okay, we need to start doing some movement. Okay, some sort of like activation. If there is pain, stop. Give it a few days. Try again. Kegels should not be causing any pain. If it's just like muscle activation, that's what you're feeling, that's okay.
Okay. Well, thank you so much. So it's time to activate our root chakra, our Muladhara. Muladhara energy starts right in the bottom on our base of our spine, and it runs all the way up to the divine on the top. So we're going to be just talking more about that area, the sacred area. And today I just feel so grateful to have Nav and her knowledge. Thank you so much for sharing. And I'm looking forward for our next chat. We're going to be talking about prolapse. And we're going to be talking deep into this issue that happens, and how to improve our pelvic floor after prolapses. So thank you so much for today. I'm looking forward for our next chat. If anybody has any questions, we will encourage you to reach to us. We're here to support you, and we're here to promote and to provide any type of help possible. As a doula and as a physiotherapist, you as a physiotherapist, we're here to empower women. So thank you so much for everybody that heard this podcast, and we keep in touch. I can't wait to talk now about the next topic. Do you have anything else to say to us?
I don't think so. No, I'd like everyone to go out and try the Kegels. If they find there is difficulty, or if they have questions, they can reach out to one of us. They can reach out to you, and then if there's one question that we see a lot of people are asking, we can maybe discuss that a little bit more next time. Yeah.
Well, thank you, Nav. Remember, everybody, together we are stronger. Thank you so much.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.